With prevention of urinary tract infection in cats, there are a few things that can help a little. Obviously, plenty of water, fresh and all that, to encourage them to drink as much as they can. Litter boxes that are kept clean. If they're a little reluctant to use the litter box, they may hold their urine a little bit longer, and with that, there can be at least a slight increase in the chances of a urinary tract infection. Routinely, you wouldn't really put them on a low crystal diet unless you were diagnosed with a problem. So there's not a lot to do to prevent that until you know that you really have problems. But just basic husbandry, litter box and water and those types of things to kind of help prevent that on a management level. And we'll get a urinalysis too. We'll look at the urine and check for the presence of blood and white blood cells and things like that. One of the biggest things that we look for are crystals in the urine, which are indication of what's really probably going on. And cats, when they metabolize their food, there are a certain percentage of cats that don't do a very good job of that. And with that, crystals will in their urine, and these under the microscope just look like pieces of quartz, and they're pretty sharp and jagged, and they cause a lot of irritation. And with that, they develop a cystitis. Those crystals are a source of the diet, whether sometimes with water sources, if they're really hard water, quote unquote, or if their food is high in certain types of minerals. So once we see that, crystals are pretty, as far as their shape goes, we can determine what's really going on and then prescribe a certain diet that will almost 100% prevent that from happening again. With males, we may not see quite the percentage of males affected, but with that, it's very dangerous. The urethra, where the urine finally exits, is narrower in a male, and they can actually accumulate crystals and other debris, and they can block where they will not pee. And with that, that's very, very painful and certainly life-threatening. And with that, they have to be hospitalized and catheterized and those types of things. So those cats are, here again, if you see crystals, they are put on a special diet, and usually, if they're on that diet exclusively, they will not return with that condition. So, but we do see a lot of that.